sympathetic nerves. So when you are under stress, and then you either run away or you fight. And if you're constantly in that fight or flight condition, then you stimulate your immune system. And that's working, thank you. And if you, is it too loud? Oh, okay. So if you stimulate your sympathetic nerve, the fight or flight part, then your whole immune system gets stimulated. And that's how your immune system started fighting the infection, and then virus infection, bacterial infection. And that's how Indian people use that turmeric to stimulate the sympathetic nerves and also stimulate the nervous system. And so the food industry advertised turmeric pepper. They said it is good for inflammation. No, it's not good for the inflammation. It's actually aggravate inflammation, because right now in this society, everything is stimulating. So you have phone, you have computer, you have news, you have everything stimulating. And when you stimulate your nerves, you actually stimulate the immune system. That is how our body always in a chronic or acute stress. So you can fight off infection or virus, bacteria, but you create a chronic inflammation, and that chronic inflammation will damage the tissue. It could be different place, like it could be in the bladder or in your eyes or different place. So optimize the inflammation level is the key to keep you from infection, but also don't have chronic intensified inflammation. So that's our goal, to optimize the inflammation. I wouldn't say strengthening your immune system. I would say optimized or balancing the immune system. So balance is the key. Balance the nerves, balance the sympathetic nerve and the parasympathetic nerves. And so back to 2000, the Nature, the magazine, they have the research that if they stimulate the vagus nerve, which is a little bit strong, you directly stimulate the vagus nerve. Vagus nerve is the main branch of the parasympathetic nerve, and then you slow down your heartbeat, and then you relax, you digest better, you can sleep deeper. At the meantime, your immune system is not like out of balance or hyperactive. So that is the key to keep the inflammation at the right level. And most of the acupressure point will be making you relaxing. When you are relaxing, your digestion is improving, you can sleep better, and your immune system will be balanced. So that's why we want to practice that. And it only takes you 20 to 30 minutes each day. So you can choose in the middle of the day or by the end of the day, just lie down. Meditation, it's good to lie down to practicing, because when you meditate sitting like this position, and then your blood pressure tends to be lowered. And when it's lowered, you have insufficient blood flow to your eyes and to your brain. So especially nowadays, we have glaucoma, macular degeneration, especially dry eye. You don't want to reduce the blood flow, and then you get blurry vision. For instance, if I meditate and if I sit there, I tried so many times and I'm still tired. And if I lie down, deep breathing and doing certain points, sometimes I put needles here or on the hand. I'm going to show most point on the hand around the wrist or the eyes. And when today I'll show you my book about the acupressure point around the face. So when I do that by lying down just 20 minutes, and by the end of the day, I can still work with more energy and my eyes are not so dry. The key is once you lie down, your blood pressure actually goes up a little bit. And then you push the point, certain point, and then you bring the blood flow to your eyes, to your gut, to your heart, and to your brain. but different brain area, the relaxing part of the brain. And that way you slow down your heartbeat, you can digest better. So that is why we do the acupressure. So the other thing I want to mention, which I don't know who is vegan, but most people here are kind of pretty skinny. So most vegans are very, very skinny. So they eat a lot of beans, nuts and seeds, tofu, which generally are very healthy. But if you only rely on that, and there are a lot of issues because you have to really balance those diet to get sufficient minerals and vitamins. And especially the nuts and seeds, even including the chia seed, um, I find it induced histamine. So a lot of people came to me and they said, oh, my macular degeneration recently get worse, and sometimes the gout get worse, and the swelling, the inflammation get worse because if you increase your histamine level, and then your blood vessel tend to leak. And if you're leaking more in joint, will be joint pain. It could be gout. It could be knee pain. So anywhere you have inflammation, if your histamine level goes up, then it aggravates the swelling. When there's more swelling, then you have more scar tissue eventually. And then, sometimes the knee suddenly swells and then you have to suck out the liquid. If not, it will take a long time to absorb that. The longer the liquid, the fluids absorbed, and then the more scar tissue. And that's why, the athlete by the age of 80, they're pretty much crippled, or, they hardly get 90 years old. So if they get 90 years old, their joints are hurting, stiff, and there are a lot of things because they always have inflammation going on. So that's inducing the histamine. There are a bunch of things you can increase your histamine. If you don't sleep, your histamine level will go up because the histamine keep you awake, keep you be alert. So if you take antihistamine for either hives or different allergies, then you get drowsy, right? But if you don't sleep, you sleep less than 5 hours or not as deep, then your histamine level goes up. So lack of sleep, and also eating a lot of nuts and seeds induce the histamine, especially almond milk and peanut butter, all of this, that will induce the histamine because peanut butter is not just the peanuts, and you don't know how many peanuts you eat. If you really want to eat nuts, I think 2-3 Brazilian nuts would be enough to give you sufficient zinc or other minerals. But you have to judge how much you can tolerate. I can only take 2-3 Brazilian nuts for 2 days, and the third day I would have increased histamine. I would have rashes, or I have sore throat, or my ear started buzzing. So all of this is because of histamine. So if you already have ear ringing and then you eat handful nuts, almonds or cashew or pistachio, then your ear ringing will get worse. Or if you already have knee swelling or ankle swelling, it will swell stuff more. But it's supposed to be good for you. Yes, that is the it's a tradition saying that it give you the good protein. But my friend who is 92 years old, and he does not eat peanut butter. He drinks milk and he drinks his coffee and he eats traditional Mediterranean diet, and that's how he has no cholesterol issue. He has no joint pain. I mean, he injured his joint many times, but he recovered. So if you already tried certain diet and your condition didn't get better, then you got to switch to another kind of diet. Because I treat so many people with ear ringing, and suddenly it get worse. If you ask them, what did you eat to make this nerve stimulation more? Either they have high stress, or they suddenly eat a handful of nuts or almonds, cashew. And interesting enough, last time I mentioned, there is a physician who is specialized in MS, which is autoimmune, right? The autoimmune is because your immune system produces antibody attacking your own tissue. And which part you attack, it depends which part you are weak, which part you have inflammation. So that's his specialty. But he himself, at age of 30, developed MS. So I talked to the mother. I said, he must be eating a lot of junk. And mother said, no, he cooks his own food. And he's very picky. He picks his food, healthy food. And then I asked him, I said, does he eat nuts and seeds? He said he lives on peanut butter. So, and people would say, oh, maybe that's a special case. But if you talk to a lot of vegans, they have allergies, autoimmune, MS, ALS. There are a lot of issues. And I observed the trend. And then every time I treat allergy cases or autoimmune, I would trace their diet. I myself, I couldn't eat too much of those, but I didn't get rid of that. Like once a month, I will challenge myself, eat a little bit of pecan, a little bit, cashew is also the worst. So you have to watch that. So if currently you have macular degeneration, you have histamine things, then you can stop eating for a couple of weeks and then you reintroduce. But I recommend you to reintroduce, like, for instance, don't eat like butter, almond butter or cashew butter. Don't eat those kind of things because you don't know how many ingredients there. So you eat 3 walnuts for 2 days and see how your body responds. But you have to reset the whole point. You stay away for a couple of weeks, and then your histamine level drop, and then you reset that. So that's the thing. I heard pine nuts are good. So there was this Chinese lady. She loved pine nuts, and she eat handful of pine nuts, and she developed this weird neuropathy in the big nerve, sciatic nerve, and she could hardly walk 1 block. She would walk. When you walk, your muscle contract, you irritates the nerves, and the nerves started firing up. She couldn't walk anymore. She has to sit down. So you just have to reset the whole body and see, what food you can tolerate. But traditional Mediterranean diet would be the recommendation because, olive oil, I wouldn't recommend coconut oil because there are studies showing coconut oil increase the stroke rate. And if you ask my friend, or I have a 93 years old acupuncturist friend, and he's in Queens, New York. She does not eat those things. She's still practicing, 93 years old. She has no medication, no pain. So I'm gonna interview her pretty soon and see. But I asked her what kind of diet she has been taking. She drinks 1 glass of water. She said she does not eat breakfast. I say, I think 3 meals are better than 2 meals. Because most functional doctor would say, 2 meals or 1 meal, it's not good. Because I used to work in gastroenterology department, and I observed that people who develop inflammation in their pancreas or gallbladder, they either skip breakfast or they skip dinner. I think 3 meals, it's good to let the whole system running. So if you don't eat, your gallbladder will not discharge the bile into your small intestine. Then it becomes so concentrated. When you finally eat, you don't eat, you skip breakfast, and by 2 p.m. you're starving. Not only you trigger the stress hormone, you have more stress hormone to cope with this hunger, but also your bile become more concentrated. So eating less is the key to keep all system running. So that back to that 93 years old lady, she drink 1 glass of water, 1 glass of green tea, 1 glass of milk. So I don't think milk is a bad thing. And I talked to my 100 years old. I have a 101 years old in Boston. I used to treat her, and 90 years old. the healthy one, not the crippled one. And they drink milk, they eat everything, but they eat less. They don't eat so much nuts. So that's the thing I learned from those 90, 100 years old healthy one. So keep your inflammation at the right level. You can avoid joint pain. You can avoid macular degeneration, glaucoma, or rosacea. If you find inflammation, there are four things you can see: redness, swelling, pain. What is the other thing? Dr. Andrew Wells said the four things about inflammation: swelling, redness, pain, and there's a fourth thing will come to my mind. So that's inflammation. So keep inflammation at the right level. You will avoid joint pain. You will avoid cancer. Even cancer is related with inflammation. If you talk to the women who have breast cancer, they usually have cysts. The other thing is don't drink too much coffee, and coffee stimulates your nerves. You drink 1 cup is fine. If you drink 2, 3 cups and you couldn't sleep, then that's not good. When you don't sleep well, your nerve started firing up. Eventually, the nerve will become dysfunctional. So that will lead to MS, ALS, neuropathy, different things. So that's how we judge. If you don't have pain, you don't have swelling, you can walk, you have good memory. Dementia and Parkinson's, it's also related with inflammation. And the other thing causing more inflammation, which also stimulate the nerves and immune system, is turmeric and also pepper. So if you go to my YouTube video, I interviewed this guy. He's a scientist. He exercised, he did all the right things, but he eats so much nuts and seeds, he eats so much spicy food. He thinks that's good to reduce inflammation. He got to the point that the sinuses here erode the frontal bone, and they have to reconstruct the bone here. And they said, oh, it's inflammation in your blood vessel and the bone. And he has to have infusion of those drugs to suppress your immune system. By suppressing the immune system, and then you tend to get infection. So he ends up 2-3 times the sinusitis, and he has to be on antibiotics. But then, because he exercised, because he generally eat healthy, so he started the herbs and acupuncture, and now he's off all the painkiller, off all the medication. The only thing he's not doing is infusion to suppress immune system every couple of months. But we're trying to see if we can get that longer and longer. So believe me, my friend always thinks that, oh, my nutritionist said turmeric is good, so I add powder of turmeric. But I see so many cases that, like my 101 years old lady, if you go to YouTube, I did a 100 years old. She used to have so much spicy food. She had 6 surgery to remove the colon. And by age, I think 80 years old, I finally recommend her. I said, you gotta get rid of your pepper. And she stopped the pepper, turmeric. Now the last surgery, and she has no bowel problems. Because the intestinal memory inflamed to the point that it caused the bowel obstruction, and you can have to cut the bowel, that part of the bowel. So diverticulitis is another thing. It's very common in this world because they eat so much nuts, and then they have high histamine. They inflame their bowel, and they got a little pocket in the colon or small intestine, and they started bleeding. And then your doctor said no nuts, and then they stopped the nuts, and the bleeding stopped. And after a little while, they started eating again, and then they come again. So, as an acupuncture patient, they usually do like once a month or after 10 session, and I was able to follow their their life, 10, 20 years and up to 25, 30 years. So I can see how they changes. If they are healthy, I'll learn from them. If there is a problem, you know, you have to change a little bit. If you're perfectly healthy, then you don't have to change. So, but even you are healthy now, the body is changing. So I used to run, I cannot run. I have to swim because if I run, I have knee pain. So the pounding, and not only the knee pain, but also the pounding can cause your disc problem. So if you squeeze out your disc, then you're really in pain. So I don't want to go there, so I have to change. It's hard not to run because it's stimulating, but swimming is also good. So let's see. Any so if you don't have the question, I'm gonna go to do the acupressure point. This is good, or you want to turn off the light? This is fine. You can see clearly. So large intestine 4 is the point everybody knows, and it's not only for the headache, toothache, and everything. It also kind of a if I needle there, then I have to lie down because it can drop your blood pressure. So that's why I think if you do the acupressure, just lie down, because if you drop your blood pressure, then your blood flow to your eyes will be compromised. And eventually, we all will have eye issues when we get to 90 or 100. So we have to protect the eyes. And by just lying down, especially when you use phone and computer many, many hours and your muscle kind of tight. So it's good to lie down and then by pressing that point. So you want me to show you, or you can just look at a picture, either way. Show, okay. So you want to, it's mostly on the hand. So Lisa will be our model. All right.
You want to do it?
Yeah. Okay, so let's see. And so if this is our hand, you put the hand together. Yeah, you put the hand together. And this is the second metacarpal bone. So this is the second bone. And so this is thumb, index finger, and then in the midline and the highest point here. So if you put together, you find that highest point. I'm going to mark that.
Put a spot on my spot?
No. Everybody has that spot. But if you eat a lot of apples and fruit, it will reduce that. Yes. And Mao, you know, Mao in China, he has a lot of those kind of a pigmentation because he loved to eat a lot of fat and the meat. He does not like vegetables. And so the vegetables, fruit and vegetables will help clear up those spots. So you see that spot? And that's the highest point. So this is between the first and second metacarpal bone. And then you put your hand together, and then that's the highest. So that's the highest point. So when you press that, you feel the pressure. And sometimes I will teach people to needle just one point, because here you're not going to injure anything because it's just the muscle, skin, and so. But the most important thing, you have to lie down when you press that, especially when you needle that, because I did that for a 94 years old in Boston, and he was on the blood pressure medication. Once you are on blood pressure medication, your blood vessel cannot constrict quickly because it's common dilating. So he was almost fainting. So he was like sweating, and so that's a large intestine 4. So headache and eye pain, anything on your head, it all helps. Lower your blood pressure is the main issue. That's why, but if you have low blood pressure like me, then you have to lie down. But generally, lie down is good. I enjoy lying down to do my meditation. So this is kind of complicated. So I'm gonna mark this point. So the hand, if we are gonna do, let's do this. So this is, you first located the wrist line. If you flex, yes. And then you see the wrist line, right? On this part, dorsal part. So the wrist line. And then you see this big ligaments here. You see the ligaments, there's 3 ligaments. If you see my hand, you see the ligaments there. And on the outside of the ligaments, on the wrist line, I'm going to put this green dots there. And that's a very good point to clearing the inflammation, not only for the wrist pain, but also the inflammation. We just mentioned that inflammation is everything, right? So the eyes inflammation, the joint and everything. So this is big, but you know, when you press with your thumb, and then you can basically cover the big area. So you feel that pressure here, right? Yeah. So if you turn like this, yes. If you see my hand, yeah, you see that dots, but if you see the ligaments on my hand, and it's outside like this here on the wrist line, right here. Yeah. So that's for wrist pain and also for chronic inflammation, even ear ringing, because ear ringing is so common now. So the reason it helps ear ringing because the channel runs from here all the way here and behind the ear and then go around the ear to here. So that's how it helped the ear ringing. So if you press here, you actually also like to smooth the energy in your, it's called a triple warmer channel. So that's another one on the wrist.
So if you're in a nightclub where the music is too loud, you can press on this point. It'll help your ears from hurting.
No, you gotta wear the earplug. Don't go there. If you go there, you have to wear earplug. If no earplug, you're gonna damage your nerves. And my daughter had that experiences. She forgot the ear plug, and then it's so loud the next day. Her ear is ringing and hurting. So that's why. So any inflammation in the throat, nose, or ear will connect it. So I mentioned that I have chronic laryngitis when I was little, twice a year, because twice a year my dad will bring a lot of candy, so I eat a lot of candies, and then it inflamed here. And then later I find out when I go to a noisy area and I have to really pay attention. And I never enjoy noisy environment because I couldn't hear. And then I have to, it makes me headache and then my ear kind of not working very well. So, and then I was thinking, I never abused my ear. I didn't use earplug, earphone, nothing. And why I have this? And then I think because the throat, because there is a eustachian tube connected here to here. So when I have that repetitive inflammation, it's also inflamed my ear. So it influences my hearing. So I'm okay with regular talking, but if there is background noise, that would be difficult. So that's one. This one is for ear ringing. And then we're gonna do the other one on the wrist, which is small intestine. So that will be first this one. It's a small intestine. So the 3 is hard to press, but the 4, which, let's see if I have better picture here. This is 4. You see on the line of your hand outside here. So I'm gonna put this dots here. So this is the 5th metacarpal bone. At the end of this bone, just between the metacarpal bone and this hamate, there's a little wrist bone called a hamate. Between this, there is an indentation here. And you see this is the This is the white part, this is the pink part. It's on the borderline of the white and the pink. So it will be right here.
Middle.
Yeah. So at the end of this metacarpal bone and between this wrist bone hamate, it's right here.
Oh, feels good.
Yeah. So that is not only for the wrist pain and also digestion, and also it will be good. You see, there's the red part and the white part, and then yeah, right here. This is the part. So that one helping digestion, wrist pain, more important for the neck and back because this channel, small intestine, running around here, here, all the way to neck, to the neck, and especially it's running around your shoulder blade. So if you press your shoulder blade here, it's very tight. It's very right? It's tight here. So that's also the muscle tend to have spasm because when you use the phone or use computer or just simply focus on something, all the muscle tighten up so you can bring the blood flow to your brain so you can focus more. That's why once you lie down, then all the muscle are relaxed. So when the muscle relax and then you press the point and through the channels, it will bring oxygen, blood flow to the area where the channel runs through. So that's the small intestine. So that is for wrist, for neck, lower back pain. So that's one. It's called a small intestine 4. So let's get small intestine 5. The 5 is on the wrist line. You just press the small intestine 4. Now you go to the wrist line on the same border between the red and the white part, and that's the small intestine 5. So I'm gonna mark that. Do we have orange? Let's get orange. So we're gonna do, you see the wrist line here, and then this is the white part, the pink part, right on this wrist line. So this kind of overlapping there. You see my finger pressed there? Yeah, it's tender, right? Yeah. Similar thing, this is the small intestine 5. It's for the back, neck, and digestion, anything related with inflammation. So, oh, the other thing I just remember, the inflammation, 4 signs, heat, swelling, pain, and redness. If you think about these 4 things, it's all related with the heat. And then where can we get this heat? When you eat too much turmeric, too much pepper, or you drink too much coffee, or you overthinking. When you think too much, your energy block in this part. So, so by pressing that, you can smooth your energy flow here all the way there, and then you can clearing up the heat. The heat is related with inflammation. And in Florida, especially in Florida, because we already have so much heat outside, you don't need to put more heat inside of the body. And that internal and external heat will aggravate the inflammation to cause a lot of issues, including the cancer. So I have a lady, she was diagnosed ALS. So that's inflammation in the spinal cord, the ALS. And she was doing okay. She eats healthy. She eats very healthy. And she's not overweight. And it's a very aggressive symptoms. And so she couldn't swallow very well. But then he went back to New Jersey. When she come back after 4 months, and I noticed that she has so much phlegm in the throat, and she can barely breathe. So I asked her, and she couldn't swallow anymore. Before she can eat, now she cannot swallow anymore. So there is a G tube, in put the food, the puree inside the stomach, and I when she was lying down there, and I was just so afraid that she was choking because the phlegm was so much, and I don't have the things to suck out the phlegm. So I asked the doctor, I said, what did you give her in the puree and to make so much phlegm? She wasn't like this before. She could breathe pretty well before. And they said, oh, we add a turmeric, we add cumin in this puree. And that they think it's good, but it stimulates the immune system and it stimulates histamine. So the blood vessel temporarily just leaking, produce the phlegm. So that's how the symptoms get aggravated faster and faster. So we need to clear the heat with this 2 point. Actually, if you use your thumb and then you actually cover 2 point, right? But I like to just use this because it's right on the wrist line. And if you use your thumb, you kind of precisely press that point. And then if you go here, you press the 4. So 4 and 5. So that's, you alternate between left and right or right and left. Because if you press too long with this hand will have pain. So we did. So the 3 is the one here, but I think a needle would be better because there are a lot of muscle here. And that's the one when I had a acute lumbar pain, back pain. I put the needles here and then that loosen up the back muscle. You see here, if you put your hand together like this, and you see there's a folding here, like right here. If you put wrist together, it's right here. Yeah, it's here. You see on the same line, but then there is a folding here. So, and if you press that, you can still feel the pressure, right? You can still feel the pressure, but needling is easier because there's more muscle there. So that is the 3. And then we talk about 4, 5. It's all on this borderline between the white part and red part. Then we are gonna do like the fingertip. It's kind of hard to do that. Then we're gonna do the other part. We did this part, this outside part. Now we're gonna go move to inside part, and that's the heart channel. The heart channel really helping the anxiety. So let's see. Yeah, there is the heart. So we're gonna do like this. And you see the wrist line on the palm side, and then you have a bone here. You see the bone here? And then right below this bone, and on the wrist line, is the heart 7. So that's very easy to locate. So, and there's no muscle here, so it's very easy to press that. So I'm gonna mark that. But for this channel, I'm gonna do just half of this little sticker so you can kind of differentiate with the small intestine and the heart. It's kind of a connected and it's related to each other. So if you don't digest well, then people will have heart problems because the minerals, the vitamins. So right on the spine and just below that bone, you see here this little half moon there or 1/4 right here on the wrist line. You see the bone, right? You feel the bone right here, and then just below the bone on the wrist line, that's the heart 7. Yeah. So that is heart 7, and then we're gonna move to heart 6. Heart 7 is for like chest pain, anxiety, anything related with your heart. So especially it calm down the nerves. We're talking about nerves connected with the immune system. So when you lie down to press this heart 7, and then you actually can also get heart 6. Heart 6 is a 0.5 inch above heart 7. And how you're gonna judge that? This one thumb is 1 inch. You use your own thumb, so you can measure that. So if you kind of lining up lining up like this. So this is the bone, this is the wrist line, and right on the wrist line is the 7. But if you press you locate your thumb like this, you actually cover 3. So if you put your thumb on the wrist line, and there's a hard 7, and then there's a hard 6, and then also hard 5. So there are 3. Because that one thumb is 1 inch according to your own body. So that will be here on the wrist line, 0.5 is the hard 6. The hard 6 is good for like generates the fluids like post-menopause, hot flashes and night sweat, or dryness, dry eyes, and everywhere is dry after menopause, so menopause is not good. So hard 6 and hard 5. So if you line up your thumb, then you cover that 3 point. So 1, 2, 3. And that's around the wrist. So locally, you're helping the wrist if you do have wrist pain, and then the other point is, I think we did that. It's easy to locate. Is right in the midline of this, right? We did last time. So that is the pericardium 7. Yeah, that's also for the wrist and for the heart. So that one. So we're gonna do that is, so pericardium is supposed to wrap the heart. So that is so right here. So you press this, and on my YouTube channel, there is also this point you can press for anxiety, because this channel, pericardium channel, runs around here, there, and ends up here, chest. So that is another point right here. Now, just one last point, and then I'll answer the question. So this is hard 3. So this is also easy to locate. So this is the wrist, the elbow crease, right? The elbow crease, and if you bend a little bit, and the end of the crease, and between this bone, so there is a nodule here. So between this bone and also the end of the crease in the midline, so that is the hard 3. And I just find out this one is very good for the tremor. So a lot of people have essential tremor, and so the end of crease, and then the bone here, the bone is epicondyle, and then in the midline here. Sore, right? Yeah, this is the hard 3. So the hard channel runs around here, there, and there. So that's the hard 3. So the hard channel runs inside, the small intestinal runs outside. So it's a corresponding channel like this. So that's the hard 3. And then the small intestine 8 is, you see this this bone here, and then you also, we locate this epicondyle, the bone, the little nodule here, and between this nodule and this bone, the tip of the elbow, in between that's the hard 8. It's small intestine 8. So small intestine 8 here. So, when you lie down, you can easily reach those points. Hard 3, small intestine 8, and then you draw a line here. That's the small intestine 5, 4, and then the heart will be here. So if you go hard 3, and then go along the palm side, and then you will see the 7, 6, and 5. So that will be located like this. So that's the heart and small intestine. So you see, always the digestion is related with everything, with your heart, with your brain. So that is why we try to connect this two. And if you look at all the Chinese formula, we put different herbs together. Each formula will always have something to make the gut healthy. Because you don't have healthy gut, you don't sleep well, then nothing is going well. So, any questions?
So, how long are you supposed to
Press that?
Yeah, and how
Um,
hard of a pressure?
it's really, you know, how hard, it depends on how you feel. Like me, I'm sensitive, so I don't press too hard. As long as you feel a little bit of pressure sensation, then that's good. Like if you press here on the eye point, and then if you press too hard, you can bruise yourself. I bruised myself before. So you will, and then you will see an indentation here if you press too hard, because you know, the eye bag and the skin after menopause is not elastic. So that's between 30 seconds to 1 minute.
So would you do like both?
I will alternate.
So you would do for the heart, let's say you would do the left arm and then the right arm?
Yes. So you kind of give both hands work to do and not overburden with one hand. Because if you do this and then you do this, it's still the one hand. Usually I use thumb or the middle finger or index finger. So if you alternate, then you don't create a pain.
Like, do you have to do both arms? Or
You can. Okay. Yeah. Because it's only 30 seconds, 1 minute. If you lie down for 20 minutes and then you alternate between, let's say, 3 points, then each point 1 minute, 2 minutes both side, you can go around this points 2-3 times. All right, so any more questions? The nerve damage, the peripheral nerves, like for instance, the crossing leg is no good for the back because you put pressure on your lower back and you also cut off the circulation to your legs. So I would sit straight and put something against your lower back. And the peripheral nerve actually, if you use acupressure, you can bring blood flow there and the circulation will be improved. I have 94 years old. Once they lie down, the purple color on both feet will be better. It's instantaneously color changes within a few minutes. So if to answer your question, the neuropathy or the nerve damage, you need fresh blood flow to let nerve regenerate. The nerve can regenerate, but it takes time. And the key is that the nerve get good circulation. And in order to get good circulation, relaxation, lying down, you can get good circulation there. Is that mine or? So usually the peripheral nerve can take a few months to regenerate, and you feel some sensation, and then your nerves started you have less numbness, less pain. So that's peripheral nerve. Now the new research showing that even the brain cells can regenerate, but it just takes longer time. And plus, even you have new cell regenerate, you have to form the connection. If those nerve damage to a certain point, you don't have connection, and so you have to reconnect those nerves, and that's taking time to practice.
Is that good for acupuncture also?
Yeah, anything acupuncture will have longer lasting, but acupuncture just it's hard. It takes money and time. So, and you have to lie down there, travel there. So that's all right. Any more questions?
I have neuropathy caused from lower back.
Yeah, because probably the disc or spinal stenosis. Yeah. So if you feel, that's why I like you to lie down, because then you reduce the pressure on your nerves, your muscle instantly relaxed. And then once the muscle relax, then you won't press the nerves too much. So you think about the brain cells. If you cut off the circulation of the brain cell, 5 minutes, the brain cell will die. The peripheral nerve can tolerate more insult, but it's not too long. If you are up 8 and go to bed at 10 o'clock, so it's 14 hours, right? So in the middle, if you lie down, then you actually improve the circulation for the next couple of hours. So there is a threshold. If you reach that threshold, then the nerve will degenerate faster.
Question. Do you connect tapping to anything?
Tapping, yes, tapping would relax, but you didn't stimulate the points as the same as you apply the pressure. Yeah. And needles can go different layers to stretch the muscle fiber, send information to the brain. So if you combine acupressure every day, and then you do needles maybe every 2 weeks or 3 weeks, that will be saving money and time and get better result.
Are you suggesting that I get rid of turmeric out of the?
I don't think you should get rid of. I think you should stop eating for a couple weeks, and then you reintroduce. But I wouldn't use powder. I would use root. I would use root because you can measure how much you eat. Like in Whole Food or Trader Joe's, they sell that turmeric root. And my friend gave me this one small piece. I said, I'm gonna judge that with my throat. You hear my throat is a little hoarse today because I eat a piece of dark chocolate, and that's also stimulate histamine. And then I have some phlegm, and so I only eat this much, this little. I tried, and then my throat hurts, and I knew I couldn't do that. But you already used for a while, so you have to reset and see how much your body will not respond. So that's So yeah, the point, this is all on YouTube channel. So if you go to my YouTube channel and you just, I actually have the card if you want to scan the code, and then you will subscribe that, and then you search in the channel, you say tendonitis, or you say lowering eye pressure, then you would see all the pressure points there. So it's only 1 minute. Then you can just practice that. And I have my acupuncturist fellow, and we did that small short, so it won't take you too long to get to that point.
Do you have a local practice?
I'm in Boca, close to Whole Food, so I'm the customer of Whole Food. So yep, that's it. So if you have more questions, and if anybody have eye problem, want to do the acupressure around eyes, and that's also on the YouTube. And I also have the book called Acupuncture and Eye Health. And if you're interested, I can give you the book. You can read that, and it's free. So the cataract is going to be hard because that's an organic problem. The circulation inflammation would be easier to resolve. The cataract is like, something happens anatomically. So you have to prevent that earlier to wear sunglasses so I put it here if anybody interested. And there's acupressure points around eyes and on the neck. So it is not, I think some of it's on YouTube. So that's and the card is here if anybody interested. The YouTube is here. So if you scan that, you will see the pressure point. The search button on the top would be just general YouTube. In the middle, that will be my channel. So if you just type Acu Li Zheng, then that will be my channel.